Hey legends, I'm Eliza Lee and you're listening to The Making of an Incredible MD, the podcast for aspiring medical professionals. Each week, we'll bring in a current MD student and a practicing physician to talk about an important topic in the medical field. From the effects of climate change to the influence of social media on our health, we'll uncover a maze of different perspectives and end each episode with an ethical dilemma for us all to consider. Stay tuned as we literally hear the making of these incredible MDs unfold right before our ears. So excited to have two incredibly talented guests today who are both Deakin med students and founding members of Skillet Kitchen. Mel is an MD3 student at Deakin, former president of Universal Health at Deakin, and it was her realization that we all have an enormous knowledge gap about food during her first year of med school that seeded the idea of creating Skillet Kitchen. And Tori is an MD1 student at Deakin and qualified aged care dietitian who is using her background in nutrition to open up our eyes to the world of better informed, more nourishing food choices. And today we're talking about the unsung topic of how food waste contributes to the climate crisis and how health professionals can play a crucial role. And P.S. stick around to the end for a Deakin-inspired MMI station about food, nutrition, and policy. Before we begin, both to Mel and Tori, can you tell me a little bit about your MD journey so far and Skillet Kitchen and what you guys are doing there, especially now at this time?
Yeah, thanks Eliza for having us on. We're really excited. So yeah, I'm Mel. I'm currently a third-year medical student at Deakin. Skillet Kitchen is a group which focuses on running cooking sessions, nutrition, communication, and sustainability workshops for all health degree students. And kind of how it works is people sign up to these workshops. It's usually free or at most $5. And as a group, we get together, we set up the kitchen, we cook together, and then we sit down and have a meal. And it's all really educational and hands-on. And you know, people really love it, and it's not a didactic learning experience.
So I'm Tori. I am a first year medical student, but I've worked as a dietitian for 4 years now. So I'm sort of coming in with a different level of experience compared to someone who might be coming straight out of an undergraduate degree. Not that there's anything wrong with that. When I got into medicine, I said, I'm moving to a new city. I need to find groups of people that will provide structure to my days. And so I was looking for a group to join that would connect the nutrition part of me and the new medical student part of me. And I really do believe that there's a distinct lack of nutrition and food knowledge in the general community, and so much so in the doctors. I've worked with so many doctors, and I really think I spent half my life as a dietitian just educating doctors as to why certain things may not be the best idea for a patient. So when I heard about Skillet, I just immediately knew that this was something I wanted to be involved in. It really stood out to me as something that really aligned with my values.
That was part of the reason why we started Skillet, actually, because even within the first couple of years of med school, we realized that there was next to nothing in terms of nutrition education. But we also felt like there wasn't really enough learning in terms of the climate crisis and how food kind of fits into that as well. And a couple of us found our little niche area in that space on food sustainability. And that's kind of how Skillet was born, with trying to close the gap between nutrition education, but also simultaneously teaching others about how your diet actually affects the environment as well.
Yeah, and what I really, really love is that it's not limited to MD students. So we're working to engage nursing, physio, OT, dietetics, everyone in between, because in real life, doctors don't work in silos. Sometimes they think they do, but they actually don't. And real life healthcare is a multidisciplinary approach and a collaboration. So the more we all work together from the start, the better we'll be able to do it when we all graduate uni.
Food is generally something that we don't necessarily link with the climate crisis. And we always hear about carbon and emissions and whatnot, but don't really think about food waste. So do you mind if you just tell us a bit more broadly about how does food and food waste tie into the current climate crisis?
Yeah, definitely. And I think you're right. I think when people hear the words climate crisis, they picture, giant factories of coal burning out, these awful dark smoke and mining quarries and transport. But yeah, people don't think about how their food contributes to climate. And realistically, something like a quarter of global agriculture actually contributes to the total carbon dioxide emissions, which is huge. That's everything from planting the seed to putting the food on your plate and heating it up at home. Ever since our economies have been so globalized and there's this demand to have produce available all year round, an individual's carbon footprint from the food that you eat is probably a lot larger than what we think it is.
Mm-hmm.
Yeah, every single step in that process contributes to carbon emissions.
And Tori, what is something that you've sort of learned about sort of the food crisis and being part of Skillet Kitchen now that, you'd like to, share with people who didn't know anything about it?
I think that people don't realise how little they plan their food, in the sense that, like, I spend a lot of my time as a dietitian about goal setting and planning, and, if we work out what we're going to eat in advance, we can go to the shops and we don't buy those extra items. But at the moment, so many of us are so busy, we can only go to the shops once a week for 1 hour, once a day for 1 hour. Then we buy on the fly. And so then the next week rolls around and we're left with food that is spoiled or expired and needs to be thrown out. And so we're left with excess food, but we're still buying more food because we didn't plan what we wanted to eat. We live a really busy lifestyle, and, I don't blame people for this. I'm guilty of it too. But I just think that probably over the last 50 years, the way that we eat has changed so much. And COVID has really highlighted how poorly many of us plan. Like the panic buying in the supermarkets back in March, and to a certain extent with this second wave in Melbourne, it was quickly followed by images plastered across the media of just how much people were throwing out. I think that if we're going to plan to solve this climate crisis, we should acknowledge the fact that if we don't plan, we're actually planning to fail. And I think that's what is happening a lot, particularly in Australia at the moment.
Something that I didn't know was, the food that you throw away at home, I think a lot of people think that it just breaks down naturally in landfill, but because all the landfill is squashed together so tightly, no oxygen can actually get into those organic materials. So it doesn't break down. And if anything, it just releases more methane and more carbon dioxide. I read a really interesting statistic that food waste was a country, it would be the third largest producer of carbon dioxide behind China and the US. So,
That's insane.
It is insane. So I think it's just really about being mindful about what you're throwing out at home as well.
Exactly. And I think like the way that we are living has changed a lot. Like 50 years ago, most people lived in a house, whereas nowadays more and more of us are living in apartments where we don't have gardens. We can't grow our own foods and vegetables. This means that we do have to essentially buy everything that we wish to consume. And then all of those things are packaged and then we leave them in our fridge, and it's just like this revolving door of waste. Whereas previously we grow what we need. We maybe have a compost for any offcuts and things of fruits and vegetables that we don't use, and then that would go back into the garden, whereas we're not doing that now. So it's like a systematic failure of the way that we're living has impacted our climate so much.
I think that's a good thing to raise in terms of perspective, that it's not necessarily our fault in terms of a lapse of knowledge. It's like what we're being fed is why we live this way. But I think it's a good, place to see, on an individual consumer level, and then on, the perspective that you guys are, which is, aspiring to become doctors and medical professionals. What are things that we can do now as everyday people? And then as for you guys as future doctors, that can really contribute to the solution of this food waste problem exacerbating the climate crisis.
So I might talk about the individual level. I think a lot of what we can do individually are a lot of what health professionals have been telling us to do for a long time, and they marry really nicely to not just a healthier environment, but also a healthier individual and community. So probably my biggest one is talking about moving towards a plant-based diet. So this doesn't mean being vegan or vegetarian. You can if you want to, that's totally fine. But it's about making veggies the hero of your dish instead of a meat product. Movements such as Meat Free Monday and things like that, there's small little nudge factors that encourage people to make better choices for the environment, but also their health. I think a lot of people in Australia grew up in a meat and three veg household. I know I did until I was about 10. It meant that, and like my beautiful mum, until I was about 10, she wasn't such a great cook, and all the vegetables would be boiled or microwaved. And whilst I appreciate that she had 4 kids, 4 little kids, it really meant that we did really enjoy our vegetables. Whereas looking at our family dynamic now, we do all get together. Veggies really are the hero of our dish because we are looking at different ways to cook them. If there's ever a time to try new things, it's now. We have so much availability in the supermarket, so with the internet, so much availability of resources and recipes. I think that if we can all increase our veggie-based meals by just 1 or 2 meals a week, it would make a huge difference in terms of not just our own health, but also our environmental health, and also be mindful of what's in season and where our food comes from. As much as I love mangoes aren't meant to be eaten in winter in Melbourne. So choosing foods that match the season that you're in. So, and practicing what I preach. I think those are like just 3 really easy things that we can work towards as individuals.
Something that I've been doing actually is trying to pick a new veggie to experiment with each week, and it makes cooking so much more fun. So if anyone is trying to, branch out and eat more veggies, that's a really fun way of doing it. And you just never really know what you'll cook up.
I love that idea. I've been trying to cook something a different way, and it's been really fun experiencing it. I purchased an air fryer, and it has changed the way I eat. So I'm a big fan.
Yeah, and then on a health professional level, there's so much we can do. And I think this is something that we have to keep in mind, especially if you're an aspiring MD student, or if you already are an MD student, or even if you're already a junior doctor. And that's recognize that the community and patients really trust and value your advice. Society really puts doctors on a pedestal. And, often that's because we see them at one of their most vulnerable periods of their life, and there's a lot of trust between patients and doctors, and doctors have a duty of care to their patients and their communities to educate them, to not just treat them, but to educate them as well and advocate for healthy lifestyle changes. Sometimes the doctor is running around like a crazy person because they're so busy, but if you're a student or if you're a junior doctor and you have a little bit of extra time, taking 5 or 10 minutes to understand what a patient's barriers are will make a huge difference. Because like you said, Eliza, a lot of these things are systematic changes and errors. We just don't have the same availability, and there are a lot of barriers that are not the patient's fault, but as a doctor, we can help them to build strategies that will get them over those barriers and onto a better and healthier path. So that's kind of what you can do at a patient level, but then also on a systematic level, we have to advocate for change. We have to advocate for food system change. And that can be at a local government level, state or federal government level, because realistically, if we want long-term change, it has to be written into policy. Something that I found really surprising was the percentage of Australians who just don't eat their fruit and veggies. So I already knew what the guidelines said, and that was, 2 serves of fruit a day and 5 serves of veg a day. But only 7.5% of Australians eat their 5 serves of veg a day, which is crazy because It's huge, like almost, 92% of people aren't eating their veggies. I think this has a lot to do with the fact that people don't really understand what a serve is. And it sounds really hard to eat 5 serves of veg a day, but when realistically it's really easy. And that's something that I've learned because, one serve is about 75 grams, but, who's measuring out their veg every day? I'm not. But that's about, half a cup of carrots, a medium tomato, and people forget that things like onion, garlic, tomato, lentils, all these staples that go into the base of every single meal count as veggies. So you're getting more in than you think. And I think what's really important is that we need to change that messaging around fruit and veg, that we need to make it so that it's really easy and people are excited to eat veggies and know that, 5 is easy, not, 5 is hard. So yeah, really changing that message.
I couldn't agree more. And that's something that I have struggled with. Maybe it's something that led me into medicine, I don't know, but subconsciously. But in my practice, I just am always astounded by how few people eat their vegetables. And in terms of like a positive and motivational messaging, like there's this really awesome program in the US called Jump with Jill, where this dietitian who happened to play in a rock band on the side, she decided that she was going to advertise fruit and vegetables to kids in their schools the same way that junk food is advertised. And obviously it's a little bit different in America, but in the end she made these rock shows that are about fruit and vegetables, and fruit and vegetable consumption went up 150% at the school. And then it flowed onto the families. And then I think like obesity, it's been about 10 years now, and like obesity rates went down, like something ridiculous, all because we changed the messaging. Obviously, I came into medicine with a slightly different perspective. I mean, I studied nutrition for 4 to 5 years and practiced it. But what has really astounded me is that we're consistently told in our public health subjects, nutrition is a form of preventative health, and doctors are people's first line health contact. And I'm like, okay, that makes sense. But we're not taught anything about it. I just think, I'm like, no wonder people are confused, because doctors don't know what the actual advice is. And I think as chronic disease increases in Australia, and we have a lack of publicly funded dietitian services, particularly for our rural and remote citizens. Before COVID, we didn't really even have telehealth. We have a system that doesn't allow people to access healthcare, like preventative healthcare, really at all. And if they live far away, well, that's their problem, and that they don't really have an option to improve their health in that way. If I was to give advice for an incoming medical student, it was to make yourself aware of nutrition, because so many conditions out there have nutrition impacts, be it preventative or treatment. It is important that we all know about it. And the other one is be so critical of sensationalized claims. I think I try to keep a tally of how many big nutrition claims doctors I follow on Twitter or I've seen prescribed to some of my patients by their doctors. And my favorite one of the past year was celery juice will cure almost anything. I promise you it will not cure anything. And it doesn't even taste good, so why torture yourself? So nutrition's a really slow-moving beast, but the evidence is generally there. So there's no excuse for doctors not to at least be nearly up to date or nearly up to date with what the advice is. Or they can just ask a dietitian, because dietitians exist for a reason, and it's kind of our jam. So we do love to talk about it.
And don't wait until you get into your MD degree to start learning about it, because realistically, your medical curriculum isn't going to have that much. If I would recommend one piece of reading for anyone who would like to get into the health sphere, not just an MD student, that would actually be the Eat Lancet Planetary Health Report.
Definitely.
Yeah, it's such an easy read, and it very clearly outlines the issues between food, agriculture, sustainability, and global health as well.
And like the other thing is, like, buy some recipe books, get on YouTube I think there's more and more what I like to call health professional influencers out there. So these are qualified health professionals who are giving nutrition advice that is appropriate. So they won't give individual nutrition advice because that's illegal, but they will give you how to break down what is appropriate, what the evidence is saying, and also where to find your evidence. And I think they're doing a really great job. And also, in terms of recipe books, if you're looking for recipe books, look for ones that are by qualified chefs. So I'm a big fan of Jamie Oliver and Ottolenghi.
Just do it.
Jamie Oliver Veg. And or go for ones that are written by health professionals. Try to avoid the ones that are highly restrictive diets or are written by some influencer who has 1 million subscribers on Instagram but no actual health qualifications. That's sort of where I would start, I think, if you're just interested in starting to get into the area.
All those things are on my reading list now then. Because celery juice is unfortunately something I drink on the daily, so lesson learnt there.
There's nothing wrong with drinking it.
Right.
There's like the big health claims. So if you like it, you can drink it, but you know, it's not going to cure your candida, I promise.
Yeah, for sure. Well, thank you so much for putting us in touch with all those resources that and now I've just realized how much really the health professionals do have an influence over what you intake, and getting a trusted source is so important there. But something that you did mention at the end, Mel, was sort of being able to affect or have an influence over the policies that we have. And this scenario that we're going to end off with, which is how we end every episode, is a bit about that. So the scenario that we have today is the UK has recently introduced legislation known as the sugar tax, where high sugar products will incur extra taxes in order to encourage citizens to choose the healthier options. What are the implications of introducing a tax such as this? And would you support the Australian government introducing a sugar tax? And would such legislation impact all Australians fairly?
This is a really good one. This was actually one of my MMI questions about a year ago when I was trying to get into Deakin Med.
Oh,
and I remember sitting in it and going, this is my moment. I'm so lucky that I got a nutrition one. So I am going to run through this one. Feel free to jump in whenever you want, Mel.
No, you're good in this.
So the way I would approach this, I'd sort of go, okay, what are the pros, what are the cons? Compare and contrast. In terms of a massive pro for this, I think that it really does shine a big spotlight on a preventable public health issue, which is obesity and probably diabetes, type 2 diabetes as well, being a tax on sugar. And it highlights the fact that our food industries are probably not doing such great things, and they are loading up a lot of our food with sugar, and that our diets aren't so great at the moment. They're highly processed for a lot of people. We've got a dentist on our Skillet team, and he was talking about how dental caries are one of the biggest public health issues. So it's so big, in fact, that dental issues are actually excluded from a lot of public health data because they would just diminish every other issue. And we know that added sugar in particular has a direct impact on people's dental health. So I think it's really important, really interesting that I think that this legislation would support this, like the prevention of dental caries. However, we also know that for some areas in our society, and Australia is a very big country, so a lot of people have to travel quite a long way to go to the supermarket and access fresh fruit and vegetables. And often fresh fruit and vegetables can be quite expensive if you live in an area that might be deemed a food desert, which is where you have to travel more than 10 kilometres to access a supermarket. And so I think it would disproportionately impact upon our lower income citizens or those people who have poor access to fresh foods, because often sugar is used as a preservative. It means that people can enjoy a meal or have access to a meal that is a lower cost and is going to last a lot longer than, whatever kale or spinach that you're having. Someone who on a higher income might be able to access. However, the tax shows that introducing a tax sort of does show that our government and our community are interested in our food systems being better. Particularly, I know when I went to school, our school canteen sold chocolate, it sold every unhealthy thing, particularly sugar sweetened beverages, which is, I think, where this tax wants to start. So like things like soft drink. And I think it would encourage schools and children's programs like community sport to purchase less soft drinks. And then it's less present in early life and educational settings. So for example, when I was studying dietetics, I did a project at the Alfred where all they did was move the soft drink under the bench. So it was still available, but all people had to do was ask for it. And in the fridges on display was just water and like soda water and whatever else people want, whatever non-sweetened beverages people wanted to drink. And soft drink consumption went down 80% just because it wasn't available, wasn't in the line of sight for people to see. And I'm like, that might be a better way of doing it and like nudging people to make better choices as opposed to taxing people, because no matter what people are going to do, they don't want to be taxed any more than what they earn either. I don't want to be taxed any more than what I earn. So I think if we simply remove, or like, oh, I see it and so I want it factor, and just nudge people to make a better choice, I think it might be a better way of approaching this issue without disproportionately impacting on low-income citizens. But also, if we tax people, we're taking away that choice. Being able to choose what we want. As we all know, we're all in quarantine and isolation at the moment. We don't have that choice of where we want to go, what we want to do. And it's really hard. So imagine if that was applied to our food and our choice was taken away, people would be angry. I think a better way maybe of approaching this issue is like a soft approach, and maybe just altering the way we advertise and have access to products like this. We did it with alcohol and cigarettes, so why not sugar sweetened foods and beverages?
Yeah, when Tori and I were discussing this, we were kind of like, oh my God, there's so many pros, there's so many cons. But I think the one thing that just Tori didn't mention that we spoke about was the fact that, you know, a tax sounds scary, but it might not be as scary if that revenue was then put into subsidizing fresh fruit and veggies.
Yeah.
But how do we do that? How can we regulate it? And how do we make sure that the people who are most vulnerable and most affected by that tax actually see the benefit? So it's so complex and multi-system factors involved.
Yeah.
But
yeah, I think my fear with this tax is that it would be written by people who are not health professionals, who are not directly involved in the industry, and they write it in such a way that it makes the people who have to implement the law, it makes their life hard. When like some laws do make your life hard, that's just the way they are, but they shouldn't be so difficult that it makes it almost impossible for you to function as a business or actually implement it. So right. I think that would be a big issue with implementing it.
Yeah, and that just comes back to, you know, what we were saying about health professionals advocating at a policy level, because we need doctors, dietitians, every aspect of health involved in writing policy that will affect those systems in society. You know, it just doesn't make sense for a politician who hasn't had any experience in it to be writing these. So it's really important to have a lot of that input.
There really couldn't be two better people to incite us about the current food crisis and how they're trying to make a difference through Skillet Kitchen, all whilst on their MD journeys. I don't know about you, but I'm definitely inspired to go learn more. And on the next episode, the direct link between climate change and global health problems. See you then!